SDG3 Good Health and Well-Being.
So, we're discussing Sustainable Development Goal 3 today, good health and well-being. What exactly does that encompass?
At its core, SDG 3 is about ensuring healthy lives and promoting well being for everyone at all ages. It's a fundamental human right and absolutely essential for sustainable development. Good health allows people to live fulfilling lives, get an education, and be productive members of society. Without it, the burden of disease carries significant economic, social, and individual costs. The targets of their SDG 3 are quite comprehensive. They cover everything from maternal and child health to fighting major epidemics.
Yes, it's a broad range. Key objectives include reducing maternal and child mortality, target 3.1 and 3.2, ending epidemics of communicable diseases like AIDS, tuberculosis, and malaria, target 3.3, and significantly reducing non-communicable diseases, NCDs, and promoting mental health, target 3.4. It also aims to ensure universal health coverage, UHC, meaning everyone has access to quality healthcare without financial hardship, target 3.8. Don't forget strengthening the prevention of substance abuse, 3.5, reducing road injuries and deaths, 3.6, universal access to sexual and reproductive care, 3.7, strengthening tobacco control, 3.A, supporting research for affordable medicines, 3.B, increasing health financing and workforce, 3.C, and improving early warning systems for global health risks, 3.D. Despite these ambitious goals, it looks like progress towards SDG 3 is largely off track globally. Many targets are unlikely to be achieved by 2030. In fact, the WHO estimated in 2023 that only about 15% of health-related SDGs were on track. And the 2024 Sustainable Development Report suggests only 16% of all SDG targets are progressing as intended.
That's concerning, especially considering how much the COVID-19 pandemic impacted global health and SDG 3 progress. It truly strained healthcare systems, disrupted essential health services like immunization programs, maternal and child health, and even the management of non-communicable diseases. We even saw tuberculosis deaths rise in 2020 for the first time in 15 years. The pandemic also highlighted significant health inequalities, particularly in low and middle income countries.
And beyond pandemics, experts point to challenges like reductions in funding for healthcare globally and the need for countries to work internationally to ensure sustainability, as national efforts might undermine other places. Progress also varies significantly across regions, with areas like sub-Saharan Africa notably lacking behind on many targets.
The European Union is deeply committed to implementing SDG 3 both within its borders and globally. Internally, they're focused on building more resilient, accessible, and inclusive healthcare systems, improving reproductive, maternal, and child health, and tackling communicable and non-communicable diseases, including mental health disorders. They also address behavioral and environmental health risk factors.
Yes, and their efforts extend globally. The EU's 2022 Global Health Strategy guides its actions on an international scale, collaborating with the World Health Organization, WHO, to achieve universal health coverage worldwide, improve health outcomes in emergencies, and enhance global health security. They're a major financial contributor to the WHO, providing $297 million in 2022-2023 alone. They also support African and other partners through initiatives like the Global Gateway and the Team Europe approach. One crucial aspect highlighted in the sources is how SDG 3 isn't an isolated goal. It's intricately linked and interdependent with all other SDGs.
Exactly. Achieving its targets requires a truly comprehensive, integrated approach involving social, economic, educational, and environmental measures, not just health in a narrow sense. For instance, reducing poverty, SDG 1, and preventing hunger, SDG 2, are highly relevant to improving health outcomes, as poverty and malnutrition are major determinants of health. Similarly, access to quality education, SDG 4, gender equality, SDG 5, and clean water and sanitation, SDG 6, are all vital for progress in health. The European Parliament strongly supports this health and all policies approach.
Let's delve into two critical areas: non-communicable diseases, or NCDs, and universal health coverage, or UHC. NCDs, like cardiovascular diseases and cancer, account for a massive 80% of the disease burden and the majority of premature deaths in the EU.
Globally, they cause over 70% of deaths each year.
These are often preventable, with risk factors including tobacco use, air pollution, physical inactivity, unhealthy diets, obesity, and excessive alcohol consumption. The EU has even launched the Healthier Together EU Non-Communicable Disease Initiative 2022 to 2027 with a budget of €353 million, aiming to reduce premature mortality from NCDs by one-third by 2030 and promote mental health.
And then there's universal health coverage. It means that everyone should receive the health services they need without facing financial hardship. This includes equitable access to quality essential services, medicines, and vaccines. The pandemic tragically showed us the fragility of health systems. It disrupted essential services and increased out-of-pocket payments, hindering progress toward UHC.
Indeed. The crisis reaffirmed that a strong and resilient health system based on primary healthcare systems is fundamental for an effective response to crises and essential for achieving UHC. Countries with UHC systems generally performed better against COVID-19.
Given these challenges, innovation is clearly crucial. The sources mention the importance of investing in research and development to create cutting-edge products and technologies that support health and well-being. Intellectual property also plays a key role, with a high number of patents being filed in areas related to SDG3, showing the speed of innovation.
And it's not just about new medicines or devices. Innovations like femtech, which uses technology to address women's health issues, are transforming care delivery and improving diagnoses. Looking forward, key strategies for achieving SDG3 include strengthening primary healthcare systems to reach every child, prioritizing maternal, newborn, and child survival, and placing greater emphasis on child and adolescent health, including mental health.
Furthermore, increasing health financing at national and international levels and investing in health workforce development are vital. This includes strengthening early detection and monitoring for NCDs and ensuring consistent follow-up. Ultimately, global unity, intersectoral collaboration, and a health in all policies approach are fundamental to overcome existing crises and prepare for future health emergencies.